Welcome back. The questions are still coming in about COVID-19, and we are continuing our live virtual conversation with Dr. Allison Madden, the Chief Medical Officer with St. Joseph Hospital. Thank you so much for staying with us, Dr. Madden.
Thank you.
And let's get right to those questions. Jeffrey asks about the accuracy of at-home tests. If you have negative home COVID tests, what are the odds of having COVID and getting a positive PCR test?
So if you're symptomatic and you're doing one of the home antigen tests, they are fairly accurate, about 85%. If you are asymptomatic, they do go down in accuracy compared to a PCR test. And they all require that you follow their directions, and depending on the test, they're slightly different. So you have to read, if you get a different test from week to week, you've got to read through it and see.
Kimberly asks, are COVID toes a real symptom? For about the past 10 days, my fingers and toes have been super sensitive to touch, water, and cold. I have no other symptoms. I'm fully vaccinated and boosted and haven't been in contact with anyone with COVID. Should I be tested?
So yeah, COVID toes do exist. It can affect the extremities, and in terms of whether you should be tested, I would discuss that with your provider. But I think when in doubt, get a test. It's easy to do. You can order them through the state, and quite easy to do.
Now in Israel, people are getting their fourth shot now, so a second booster. Do you think there will be a point where we need to do that here in the U.S.?
I think it's certainly possible. I know that many of the companies are working on Omicron-specific vaccines. You know, who knows? After Omicron, there might be a different variant. I think that's highly likely. So we'll have to see. Right now, 3 doses for most people is the recommendation, and I think we'll have to see where it goes from here.
Well, Susan is asking, what is your opinion about the impact of mask wearing in public places?
I think it's very effective. It is not 100% protective, but it is very protective. We saw such large decreases in the flu last year, and I think that was in part due to masking. It also decreased COVID dramatically when people masked in public places, especially indoor public places.
Megan asks, are efforts being made in the U.S. to study whether or not Omicron can cause long COVID? And if so, when would those results begin to show up?
Yeah, I think that's a great question. Omicron does seem to be slightly milder, but we have to look at how it acts in time and in this country and see. And I think it is certainly possible that Omicron does bring with it a risk for long COVID, the way that the other variants do, but we just don't know yet.
Well, Lynn asks, if you have already gotten and recovered from COVID, do you get the vaccine or do you get tested for antibodies? What is your recommendation here?
I would get the vaccine. There's good data that having COVID and recovering does give you some protection. But if you had COVID and are recovered and get the vaccine, you have markedly more protection than just measuring antibody levels, which are really quite variable and aren't going to protect you. They're just going to tell you what your antibodies are on that day. The vaccine is safe for people who have had COVID. If you've had monoclonal antibody treatment, you need to wait 90 days, but otherwise you can get it as soon as you're recovered from COVID, and will protect you.
Susan asks, she says she is going to a wedding and she says, if all the people at my table are all vaccinated and boosted and I don't visit other tables, is there still a high risk of infection?
Well, I mean, I think that's a fairly safe situation. It depends on how many people are at the wedding. It depends on how many other people in the room have been vaccinated and boosted and what the ventilation is. So it's hard to predict. I think large group events, there's always going to be more risk than small group events, regardless of people's vaccination status. So a little hard to know for certain.
Dr. Madden, thank you so much. Great information here. We really appreciate it. Thank you.
Thank you so much.